Hi, I'm Jeannie,
And I'm Amanda.
and today we're going to talk about midwifery care in the community setting. This presentation is an overview of California licensed midwives' scope of practice and model of care. Because individualized care is foundational to midwifery in a community setting, differences in style and philosophy vary from provider to provider. Accordingly, the information presented today was created through the lens of our private practice.
Before we begin, we should review the midwives' model of care. We work with a low-risk population. We only use interventions as needed. The care is family-centered. We offer continuity of care with providers. We monitor physical, psychological, and social well-being. We provide individualized counseling and clinical care through pregnancy, labor, birth, and postpartum. We identify and refer those who require obstetrical attention.
Part 1, Prenatal Care. Let's take a moment to talk about routine visits. Visits can happen in a clinic setting or in families' homes. We have a visit every 4 weeks through 28 weeks, and then every 2 weeks from 28 to 36 weeks gestation, and then we have weekly visits from 36 weeks until labor begins. Each visit has a counseling portion where we discuss physical and emotional well-being. We reconfirm our client's low-risk status and rule out complications. We provide anticipatory guidance. We always have informed choice discussions whenever there's an upcoming test or intervention or medication that's being proposed. We offer wellness counseling for nutrition, movement, and mental health, and we recommend vitamins and supplements. We also provide clinical care during our prenatal visits, and each visit includes taking vital signs for the pregnant person, their blood pressure, pulse, temperature. We also do a fetal assessment, which includes a fundal height, fetal heart rate assessment, and we palpate for fetal position and estimated fetal weight later on in pregnancy. We also offer counseling for the Tdap and influenza immunizations and offer RhoGAM at 28 weeks for anyone who needs it. We also collect labs during our prenatal visits. We offer all routine labs during pregnancy according to weeks gestation, including genetic testing. We provide referrals and consultations whenever indicated. That includes for ultrasound imaging, for antenatal testing, and we refer to OBs, perinatologists, and specialists when indicated, especially when we need to rule out complications and reconfirm a client's low-risk status. We also refer out for physical therapy and non-hospital-based therapies and treatments, such as acupuncture, psychotherapy, and dietetics. And here's a brief overview of the tools we use during our prenatal visits. A Doppler device, a fetoscope, blood pressure monitor, stethoscope, tape measure, thermometer, lab collection and blood draw supplies, and we also use an ultrasound imaging device at term to confirm that the baby is head down.
Part 2, Interpartum Care. Now let's talk about labor and birth. Midwives attend births at home between 37 and 42 weeks gestation. Midwives join the laboring person in active labor or earlier when indicated. We provide intermittent auscultation to confirm ongoing reassuring fetal status. And we measure the laboring person's vital signs to also confirm their low-risk status. 2 licensed midwives are present at each birth to co-manage second stage and beyond. This way, there's a dedicated provider for each patient. We also offer active or expectant management of the third stage. In labor and birth, we offer a calm and peaceful environment. Movement and position changes throughout labor are encouraged to the birthing person's comfort. We offer continuous physical and emotional support, including encouraging hydration and nourishment, perineal support and gentle positions in second stage to minimize laceration, and intervention only when indicated. This includes inclusive decision making. The immediate postpartum. We encourage immediate skin-to-skin, delayed cord clamping, postpartum hemorrhage assessment and management, neonatal resuscitation measures when indicated, and APGAR score assessment. We offer ongoing assessment of the birthing person's vital signs, fundal position, and tone, as well as ongoing assessment of newborn vital signs. We assess for lacerations and repair as needed. We do a comprehensive newborn exam. We administer newborn medications including vitamin K and erythromycin eye ointment. We do a newborn blood typing and direct Coombs when indicated. And we support establishing lactation. We always confirm the status of the birthing person and newborn before we depart, which usually takes place at about 2 to 4 hours post-delivery. Let's talk about indications for transport. The most common indication for transport in labor is for pharmacological pain relief and/or therapeutic rest for a prolonged labor. Other indications for intrapartum transport include fetal status no longer reassuring, the laboring person's status no longer reassuring. Other reasons for immediate postpartum hospital transport include persistent postpartum hemorrhage, signs and symptoms of shock, repair for 3rd or 4th degree laceration, retained placenta, placental fragments and membranes, and non-reassuring neonatal status. Intrapartum, we use these tools and medications. To monitor the laboring person and the baby, we use the Doppler device, a thermometer, a blood pressure monitor, and an adult pulse oximeter. We carry sterile instruments to cut and clamp the cord, suturing instruments, ring forceps, episiotomy scissors, and a speculum. We carry the following medications. For the birthing person, Pitocin, misoprostol, Methergin, TXA, epinephrine, antibiotics, lidocaine. For the neonate, vitamin K, and erythromycin eye ointment. We also carry resuscitation equipment. This includes a bag and mask and an LMA for the neonate, neonatal pulse oximeter, O2 tank and equipment, warming pad, blankets and hats, foil bunting, DeLee and a bulb syringe, and for the birthing person, an adult pulse oximeter, O2 tank and equipment, and IV fluids. Other items that we carry include IV supplies and fluids, suturing supplies, catheterization supplies, AMI hooks, lab supplies, and to assess the newborn, we carry an infant scale, thermometer, infant stethoscope, tape measure, glucometer. In preparation for the birth, each family orders a birth kit. The birth kit includes underpads, drapes, sterile gauze, sterile gloves, non-sterile gloves, alcohol pads, sterile lube, a cord clamp or tie, germicidal wipes, and they can order a birth tub if they desire.
Part 3, Postpartum and Newborn Care. Let's talk about routine visits. These visits happen in families' homes and/or clinic setting. We offer visits on day 1, day 3, 1 week, 2 weeks, and 6 weeks postpartum for both the birthing person and the baby. Visits last 1 to 2 hours. Early postpartum visits take place at home to promote rest, healing, nursing, and bonding. And midwives provide postpartum and neonatal referrals and consultations as indicated. Each visit includes a counseling portion where we discuss physical and emotional well-being, reconfirm low-risk status and rule out complications for both the birthing person and the newborn. We offer comprehensive lactation support, newborn care counseling, wellness counseling for nutrition, movement, and mental health. We recommend vitamins and supplements. And we also offer family planning counseling as well as a postpartum mood disorder screen at 6 weeks postpartum. In the clinical portion of our visits, we assess the birthing person by taking their vital signs, assessing fundal position and firmness, as well as bleeding, assessing breast or chest health. We assess the healing of a laceration and or repair. We also perform a pelvic exam, assess for prolapse, as well as diastasis recti, and offer a PAP when indicated at their 6-week visit. For newborn assessments, we monitor heart rate and rhythm, respirations, their growth. We always do a head-to-toe exam. We assess for any jaundice, and we perform the metabolic and cardiac screens at the day 1 visit. We offer referrals and consultations to OBs, perinates, and pediatricians when indicated. We also refer out for the newborn hearing screen, as well as physical therapy and pelvic floor therapy. We refer to IBCLCs for more in-depth or long-term cases. We also refer to ENTs or dentists for frenotomy assessments and releases, and also non-hospital-based services like acupuncture, psychotherapy, dietetics, and bodywork. The tools we use for postpartum and newborn care include, for the birthing person, blood pressure monitor, stethoscope, thermometer, lab supplies, and lactation supplies. For the well baby, we use an infant scale, infant stethoscope, tape measure, thermometer, and supplementation supplies when needed. And that wraps up our overview of midwifery care in the community setting. Thank you so much for watching and listening.